A very popular topic in the media recently has been the discussion about UK medical doctors versus IMG doctors in terms of specialty training, the intervention of BMA and every other thing all around it. And it's quite a sensitive discussion right now because seriously, this is something that involves people's future, people's career, and I think it deserves to actually gain a lot of attention. Yes, I was really reluctant to talk about it here on my channel, but then I feel like being an IMG doctor who has had the opportunity to be in the NHS, and I feel like I should be able to actually talk about it, and so that's why I decided to make this video. And so in this video today, I'm just going to be sharing my views about what exactly is going on, UK medical graduates versus IMG, the place of the BMA, and what are the possible factors that could even be responsible for this current crisis that is going on. And so if this is something that interests you, then why don't you wait and come with me until the end of this video today. Hello, my name is Blessing and I am a first year psychiatry training here in the UK, and here on this channel I talk about medicine, I talk about matters relating to doctors, as I also share about my experience or my journey as a medical doctor in training here in the UK. You're welcome to become a part of the community. Feel free to join us. And so without further ado, let's just get into the crux of today's discussion. Okay, to start with, BMA released a statement saying, and basically the summary of that statement is that UK medical graduates should be more like UK medical graduates should be prioritized for specialty training, while IMG doctors will be considered on the same level as these UK medical graduates if they have up to 2 years of NHS experience. And this is actually for IMG doctors who have joined the NHS before the 5th of March 2025. And so I'm not very clear about what happens to future doctors who join the NHS after that date, but I am guessing that it will probably be that they also have to get 2 years of NHS experience for them to be able to apply for specialty training. After this statement, when the statement was released, there was a lot of reaction from a lot of IMG doctors. I'm actually aware that some persons actually came out of BMA membership, and whether or not we like it, this issue has actually been in the air for a while. The whole issue about immigrants, IMG doctors taking up jobs in the UK and a whole lot of that. There was a riot that happened sometimes last year, where the UK locals were, talking about the fact that IMGs or immigrants were taking up their jobs, taking up a whole lot of things, and there were riots across the country, but everything settled quickly. And also in the media recently, there has been a whole lot of anti-immigration talks, and so I am not surprised that this discussion is becoming even louder. But then, how does this, as doctors, how does this affect us? So really, the truth is, for the BMA trying to lobby for UK medical graduates to be prioritized over IMG doctors, I wouldn't say it's unexpected, because there are some countries where it's almost impossible for IMG doctors to actually get into specialty training. It was majorly dominated by the locally trained doctors, and in some other countries it's easier for the IMG doctors to be able to compete with even the locally trained doctors. So UK used to be a country in the past where it was almost impossible for IMG doctors to be able to get into specialty training, and even if they did, they were limited to some specialties, and that was because of the resident labor market test, which was more like when it comes to allocating the training slots available, the UK medical graduates were considered first, followed by the doctors within the EU region and those with settlement status. And afterwards, whatever was left what was handed over to the IMG doctors. So just imagine the specialties that would be available to IMG doctors. And so that was the situation until 2019, when medicine was now put on the shortage occupational list, and that took away that restriction, making it possible for IMG doctors to be able to apply into specialty training of their choice. And so in the 2020s, 2021, there wasn't really any issue about UK medical graduates not getting jobs. However, a lot of things have actually changed over the last few years that I feel is contributing to this issue. And I feel like those are the issues that the BMA should be attempting to resolve, to find ways around, instead of just making it look like they are lobbying for the UK medical graduates to be prioritized over the IMGs. So the number one is the fact that medical graduates, undergraduates posts were increased, and this is because the country generally is trying to make an effort to increase the number of locally trained medical professionals in order to reduce the over-reliance of the NHS on international professionals. The medical graduate posts were increased, but nothing was done in terms of the job availability when they eventually graduate from medical school. So let me just put some figures to it. So in 2023, about 9,200 doctors graduated from medical school, and this number has gradually increased, and it's anticipated that in 2025 over 12,000 doctors are expected to graduate from medical school. Now, in terms of the job availability, like specialty training posts, not so much change has happened, not so much expansion has happened in terms of this law to be able to accommodate this increasing number of medical graduates. And I feel like that is one of the reasons why we are having all of these issues around UK medical graduates not being able to get into specialty training. Let's also talk about some other peculiarities about the specialty training in the UK. And just to make it clear that it actually favors the UK medical graduates much more than the IMGs. And this is because a lot of specialties actually require what we call a portfolio for the recruitment assessment. And a whole lot of IMGs, of course, do not have portfolios. And so it's easier for the UK medical graduates during their foundation years 1 and 2 to build their portfolio ahead of their like in preparation for their desired specialty training post. And that is usually what it is. And so a lot of UK medical graduates are able to get into the specialty training post, while the IMGs, on the other hand, are okay to actually come in for the non-training roles. That gives them the opportunity to build their portfolio for their desired specialty, to also give them some time to understand the NHS system and to be able to settle into the system before starting a serious commitment like residency. However, in towards the end of 2022-2023, the non-training roles started becoming much more difficult for IMGs to actually get into, whether it was due to a reduction in the number of the available jobs, whether it was an intentional reduction in the number of available non-training roles, or whether it was due to an increased number of IMG doctors applying for these jobs. But then it became obvious that it was becoming much more difficult for IMG doctors to actually get into these non-training roles. And that is why they, of course, out of desperation, because to actually become GMC licensed is not just something that is handed over to you. As an IMG doctor, a lot goes into becoming GMC licensed. You have to sit for exams, quite expensive exam. In another video, I'm actually planning to do a breakdown of how much it costs for an IMG doctor to actually become GMC qualified. It actually involves a whole lot of money, a whole lot of both financial, academic, and even timely investment, you know, for you to pass those exams and become GMC licensed. These IMG doctors are able to come in for this non-training post, and so maybe after a year or two, when they feel they are ready to go into specialty training, then they apply for the specialty training. But because the non-training roles are become quite scarce, they have had to take the alternative route, which was to come in directly for this for the specialty training. And now when we talk about the specialty training, keep in mind also that the old portfolio system is still in place, and so IMG doctors are only able to come into those specialties where portfolio in a way is not required. And the two most popular specialties within that category is the GP and psychiatry. Psychiatry used to require the portfolio system or portfolio in previous time for assessment, but I think as a way of encouraging more doctors to actually come into specialty training in psychiatry, that was taken out of the way. So majorly, a lot of IMGs are actually coming in to take up slots in this two major specialties. I understand that there are some other specialties that also welcome IMGs, but I don't have the details of those ones. But I know that for psychiatry and GP, it's easier for IMGs to come into those specialties because portfolio is not required. And so I'm just saying that now, looking at all of this, it means that the other specialties, the major specialties that require a portfolio, are more favorable to the UK medical graduates who would have built their portfolio over time. So, when they are now saying that, oh, when we're now talking about the number of IMGs coming into specialty training, so we give the total figure of, oh, this was the number in 2020 and this is the number in 2024. But I wish we can have like more figures of breakdown in each of these specialties. How many IMGs were able to get slots in neurosurgery? How many IMG doctors were able to get slots in specialties like cardiothoracic surgery, in cardiology, in specialties like that, and not just the total number of IMG doctors taking up those training slots. So there is no doubt about the fact that the number of IMG doctors getting into specialty training have increased over the last 2 years. And so much more than just looking at the general figure, can we also look at what resulted in this? So now, talking more frankly, I feel like now this is the point where we should start talking about the fact that, is it possible for specialty training roles to be expanded such that it is able to accommodate both the UK medical graduates and also the IMG doctors? And this is because for every doctor who is coming to practice in any country, really, I feel like one of the things that actually make UK attractive to a lot of international medical doctors is not just the pay, but much more the fact that they have the opportunity to be able to progress with their career. For every doctor, something that is very important to every doctor, from irrespective of whichever country you graduated from, is the opportunity to be able to progress in your career. And I feel like this is what is actually at stake with this current discussion about trying to prioritize the UK medical graduates over the IMG doctors, because I feel like even the IMG doctors who is coming into the UK to work in the NHS, it is with the hope that they will have the opportunity to be able to progress in their career. And so if that is no longer going to be the case, I feel like this should be made very clear, so that if any IMG doctor wants to make that decision, they can be able to make an informed decision, knowing that they are only going to be able to work to earn pay in the UK without any opportunity for career progression, or maybe very difficult or strict or maybe reduced opportunity for career progression. Instead of talking about this thing as though the IMG doctors are taking up the jobs that are meant for the UK medical graduates, I think we should start talking about what are the factors that has resulted into this. Is there a way it can be controlled? Is there a way it can be addressed? Are there adjustments that needs to be made in order to reduce the burden of unemployment in terms of specialty training within the NHS? Another factor I feel might be contributing to this is the fact that the number of IMG doctors that have become GMC licensed is massive. Just in 2024 alone, about over 19,000 doctors actually sat for the PLAB 2 exam, and over 15,000 of these doctors passed the exam and are likely to become and probably have become GMC licensed. Is there a job available for these over 15,000 doctors? I doubt if there is. Now, I feel like this is the point where we should start talking about the fact that, is there a possibility of actually controlling the number of doctors who become GMC licensed per time by reducing the number of PLAB 2 spaces annually? Because if that is done, in a way, it can actually control the number of doctors who become GMC licensed and who plan to get into the NHS system. Because whether or not we like it, it's actually not so easy for these doctors who have invested so much money, so much time, into writing and sitting for these exams, and only for their hopes to be dashed that they can't seem to get a job, and even now is looking like it might become much more difficult to even get into specialty training if you are even eventually able to get into the NHS system. It's possible to actually consider this discussion from both angles. I understand the frustration of UK medical graduates, because a lot goes into becoming a doctor, like graduating from the UK. A lot of persons have to take loans, in order to pay for their medical education. And I understand the frustration when you now finish going through all of this hassle and then you're struggling to get a job and you're not even sure of what the future holds. Maybe the best way to resolve this should not be maybe picking one over the other person, because I feel like these two categories of doctors actually give their best to the NHS. Everyone should have the chance to be able to progress in their career. In conclusion, I think, like I will always say in my videos, that for IMG doctors, you know, especially if you have not started, if you have not gone too far with the UK, with the PLAB pathway, I feel like this might be a time for you to actually get enough information and be able to make an informed decision. You know, PLAB exam, you know, becoming a UK doctor is not what it used to be 5 years ago. Now a lot has changed, and I feel like before you take that step, be sure that it's something you want to commit yourself into, because as far as I'm concerned, I feel like the future is bleak. There's no assurance about what the situation might be, especially because there's been a lot of talk about immigration, you know, in the media, and I am thinking that in the coming future, like in the coming months, in the coming years, immigration policies might be changed. You know, a lot of rules might be rolled out, and who knows, some of this might be unfavorable, you know, to immigrants, and making immigration maybe a bit difficult or unattractive. So I'm just saying that before committing yourself into that pathway, you know, just be sure that it's something you really want to pursue. If not, I think this is the point where you should start considering alternative plans. You know, what happens if the UK does not happen? What other plan do you have in place? Do you think instead of going the UK pathway, do you want to consider other countries like Canada, like the US? There are some other countries that are open to IMGs, and I think I made a video about it. You might also want to check out that video. And or maybe this is by where you want to, you know, try doing some part of your residency training in your own country, and then moving over to the UK for middle grade roles or for higher training. I really hope that this issue will be sorted out in a way that is going to favor both categories of doctors. And so this is why I'm going to be ending this video today. Don't forget to like, to share, to comment, and also subscribe to this channel. Until I see you again, take care. Bye.